Are you considering laser vision correction? Laser vision correction can give you an entirely new sense of freedom. Freedom from eyeglasses, contact lenses with years and years of solutions, not to mention the freedom of mobility and the ability to see at a level you haven't been able to in years. Perhaps you've been thinking about it, but haven't taken that first step. Whether it's for a financial reason, you're just not sure which procedure is right for you, or you have a little bit of fear of the unknown, the professionals at Beach Eye Care can answer all of your questions. Meet Dr. G. Peyton Nietrauer and Dr. Vic Jane, ophthalmologists and laser vision correction specialists at Beach Eye Care. With over 30 years of combined experience, and over 30,000 procedures performed in Hampton Roads alone, it's no surprise that Beach Eye Care has an impeccable reputation as a Best of the Beach winner for over a decade. Why is Beach Eye Care the best place in the area for laser vision correction? Both Drs. Nietrauer and Jane are board certified by the American Board of Eye Surgery to perform both LASIK and cataract surgeries. Only 1 in 10 doctors has this certification. Their commitment to the future of vision care technologies is evidenced through their continuing work as assistant professors at Eastern Virginia Medical School, teaching residents laser vision correction. Well-versed in all of the advances in procedures and technologies, you can be sure that the Beach Eye Care team can help guide you to the discovery of the best procedure for your vision care needs. With every procedure, it is our mission to offer you care that is ultimately focused on the overall health and safety of your eyes at all times. That fact, paired with our caring staff, comforting amenities, and complete attention to your satisfaction, will give you complete peace of mind. So what is the first step to better vision? That's simple. There are several easy ways for you to schedule a free consultation to discuss laser vision correction and the difference it can make in your life. Click a link from our website, call us, or use your mobile device to make scheduling quick and easy. Then, when you come for your initial consultation, prepare to have all of your questions answered.
So when you come to visit us for your complimentary consultation for vision correction, we'll take a look at your current prescription of your glasses. We'll look at Pentacam. That gives us 4 maps of the cornea, telling about the curves of the eye, the topography, like a color contour map, and the thickness. We can use that information factored along with your vision needs, a lot of which is age or time-based. So you'll leave knowing about your best vision correction options, what the cost would be, financing options, all those key things you need to move to that next step, your most thorough eye exam ever, the pre-surgical evaluation. On the day of your thorough pre-surgical evaluation, you'll go through a very extensive exam that starts with looking at how your whole eye processes light. That's a wave print. So wavefront technology allows us to shine 240 rays of lights into the eye, see how they're processed when they come out. About 10% of us have more distortions than normal, called high-order aberrations, and that's when a wavefront guided or custom treatment benefits you. Of course, we'll do our usual things in an eye exam of looking at your vision without glasses, with your current glasses, do a new refraction so we know what's best for you with the power of your eyes. That's called the refractive power in glasses. We will look at the Pentacam that we talked about during your complimentary consultation. We'll look at the strength of your eye with a test of corneal biomechanics that measures your eye pressure as well, called an ORA or Ocular Response Analyzer. We will then also look at contrast sensitivity, how you see the gray on white, the health of the internal part of your eye with an Optos retinal scan that shows the nerve and the retina, 80+% of it without any dilation. Then we will review all those details with you, factor in your young age, your vision goals.
Based on the topography of the Pentacam, if they're nearsighted, we'd recommend either doing an intraLASIK wavefront optimized treatment or a guided treatment to provide them the best distance vision, or the blended or monovision depending on their age. If the corneal thickness is lower, 500 microns or less, and their prescription is a little higher, then we may recommend a procedure called PRK. It's a little longer healing time, but it would be a safer procedure for the patient. Other indications that we use PRK if they have any corneal irregularities called map dot fingerprint, which is a corneal dystrophy, where patients may wake up with pain in their eyes in the morning. PRK would be a better procedure for them. There are some patients that are too nearsighted that we can't do LASIK or PRK, but we have a tool or technology called ICL. It's an implantable lens that goes in front of the natural lens and behind the iris, which is done across the street at a surgery center. Patients that are farsighted have options as well, and have astigmatism have options as well. Farsighted patients we can treat with LASIK or PRK depending on how the topography is. If they have truly good distance vision and want only just one eye treated to give them back their near vision and they're 40+ years of age, we can do a procedure called CK or conductive keratoplasty. With our vast array of technology that we have here at Beach Eye Care, there are very few patients that are not candidates for surgery, and we're going to provide the best care for you to provide the best vision possible.
Following your meeting, you'll then meet with a refractive coordinator who can schedule your procedure and answer all your questions about pre-op, post-op instructions, and payment. Now let's talk a little bit about what to expect. On the day of your procedure, you will be here an hour and a half. You'll be greeted at the front desk and complete consent forms and paperwork and take Valium.
On the day of your procedure, you'll join me in the laser suite for about 20 minutes from the time you walk in the laser suite till you walk out. You'll go first to the intralaser, which is the infrared laser we use to create that protective flap. So you recline in one chair, that brings you on underneath the laser. You'll get a facial with betadine where we clean around the eyelids, gives us a nice clean area in which to work. We put, of course, numbing drops in your eye. We tape close the eye we're not treating. And then you're looking up into the intralaser, which has two circles of lights. It looks like the mothership landing. And it's about a 30-second process where we bring you and the intralaser together. That's called docking. Vision grays out. You have a little bit of a sinus headache pressure. I reassure you to be as still and steady as possible. The Valium you've already taken certainly helps you relax and takes the edge off. And that's when we're creating that protective flap in about 14 seconds, and it's at the speed of 150,000 pulses a second. So that's for the right eye first, left eye second. We check an ultrasound after each so we know the thickness of the flap. It's about 1/5 the thickness of the cornea. Then you move out of that laser, the intralaser, and on over to the IQ laser, or a different room if we're doing a custom view treatment for you on the Visex laser. So at the IQ laser, that's where we'll correct your nearsightedness, farsightedness, or astigmatism. Again, you don't have to worry about blinking. Another numbing drop. Lid opener, just gently hold your eyelids open for about 2 or 3 seconds and you adjust to that part. The length of time of the laser treatment varies depending upon your degree of refractive error. So if you have a mild degree of nearsightedness, it could be 5 seconds or less. The laser's rapid, 400 pulses a second. If you've got a higher degree of nearsightedness or some farsightedness, we may go as long as 25 seconds of laser treatment time. Once that part's complete, the protective flap's put right back in position. You just see shadows as it's rinsed and in position. We put in drops for you and then move to your other eye to complete it. As you're coming out from underneath the excimer laser that's corrected your vision, and you look up at the ceiling tiles, they were all out of focus, a big blob before. But now you can start to see the grid on the ceiling tiles and the details. You'll sit up, you'll look around the room, you'll start to read things up on the wall, you'll see the clock. So you notice an immediate improvement in your vision.
Once your surgery is completed, patients generally goes home for a 2-hour nap where your eyes may feel scratchy, itchy, burny, tearing. You go home, you put a drop in your eyes, place those eye shields over your eyes, and you take a nap for a couple hours. When you wake up, the eye should be feeling a lot better, the vision should be improving. You're going to be rotating drops every half an hour while you're awake that day. You're getting a call that evening by your surgeon to see how you're doing, making sure the vision's improving, and then you're seen the next day for a follow-up to check your visual acuity, make sure that your visual acuity is improving. And then what to expect, you're on antibiotic drops for about a week, and some tear drops for about a month, and steroid drops for about a week. The restrictions after surgery is no rubbing, no swimming, and for the ladies, no eye makeup for 1 week.
Expectations with your vision steadily improving. Reaches its peak at the 1 to 3 month mark. That will kind of give you your final result there. And we're after 20 happy, that 2015 to 2025 distance to near vision without glasses. So you'll have a 1 month follow-up and then either a 3 or 6 month follow-up, depending upon how you're doing at the 1 month visit. It's important for us to control dryness of the eyes. Everybody has it for the first month. For 2/3 of us, it's gone after a month, and then you just use tears as needed. For the other third, it can linger for 2 to 9 months. So we'll be on treating that dryness for you to get you that best possible result.
We've shown you all of the exciting reasons to choose Beach Eye Care. You've seen how affordable it can be. You've seen how to make an appointment to have all your questions answered. And you've learned about the level of professionalism available to you to give you your best vision ever. The best doctors, the best support team, sympathetic, caring people to answer your questions, and the gift of good vision. Dr. Nietrauer and Dr. Lipton, one of Beach Eye Care's optometrists, have both actually had laser vision correction themselves, so they can even provide you with their own personal experiences. The time to call or click Beach Eye Care is now.
Call Beach Eye Care today at 757-425-5550 or beacheyecare.com on your computer, tablet, or mobile phone so you can learn more about your vision correction options. That's 757-425-5550. Experience matters. We share your vision.